It's another Hello Healthy, a Dignity Health podcast with Bill Klaproth.
Hearing that it's time for you to get a colonoscopy gives many people an uneasy feeling. However, getting screened is one of the most effective ways to prevent colon cancer. Here to talk with us about colorectal cancer awareness and screening is Dr. Lawrence Malalari, a colorectal surgeon at Dignity Health. Dr. Malalari, thank you so much for your time. So, first off, why is colon cancer so deadly?
Hi, Bill, and thanks for having me. Colorectal cancer is unfortunately a very deadly disease. It is the second cause of cancer-related deaths in the United States, and is the third most common diagnosed cancer actually in the United States. Most people don't realize this, but more people die from colon cancer than die from prostate cancer or even breast cancer. But it's unfortunately a fairly deadly disease, but it's a disease that we can prevent and we can treat if we can catch it early. Hence the awareness month that we're getting into.
So important. So speaking of awareness and catching it early, can you tell us then why colorectal screenings are so important?
Colorectal cancer is one of those cancers that we know exactly where it develops, how it progresses, and how it's going to start from normal tissue to cancer. Because we know this, we have developed ways to identify patients that are at risk of developing the colorectal cancers. And we do this test through screening tests. There's a total of 3 types of tests that we have currently. One is a stool test. There's a number of them. And there's the endoscopic test, which is colonoscopy that most people dread when they hear the word. And there's also a radiological test. And these tests are to identify those abnormal lesions in the colon that can turn into cancer and hopefully find them and remove them before they do turn into cancer.
And are the screenings really important because there aren't really any definable symptoms?
So unfortunately, colorectal cancer is a bit of a silent disease. There's very few, if any, symptoms that will develop at least early on when the cancer is growing. Most people will experience things like bleeding when they go to the bathroom, changes in their bowel habits, diarrhea, constipation, change in the caliber of the stool, or crampy and vague abdominal pain. Weakness, weight loss are also commonly seen in patients with colorectal cancer. And as you can tell from what I just mentioned, these are very common, very non-specific type symptoms. Just because you're having, diarrhea, constipation, or changes in your bowel movement does not mean that you have a colorectal cancer. That's what makes this disease, unfortunately, difficult to diagnose without a screening test.
Right. It could be a bad night out or something. You have those symptoms. Oh, my. So is it a good rule of thumb, then, if these symptoms persist for longer than a couple of weeks or a period of time, that's when you should consider seeing a doctor?
Absolutely. So whenever, changes like this happen, they should never be persistent. So any symptoms that are new and do not go away after a short period of time, they should always be discussed with a physician to look for a different cause for those symptoms. And unfortunately, cancer is one of them and should not be dismissed.
Mm-hmm. And Dr. Malalari, in general, then, at what age should people start getting screened?
So screening age is currently being recommended by a number of surgical and oncological societies as part of guidelines that we recommend patients follow. The current guidelines recommend anyone at age 50 start getting a screening colonoscopy. Having said that, more recently we've been finding that a lot of patients under 50 are developing colorectal cancers. Approximately 10% actually of new colorectal cancers in the U.S. now are being found in patients less than 50. So the American Cancer Society has lowered their screening guidelines to 45. And the screening tests are varied, as I mentioned earlier, but at least an initial screening should be started at age 50 or 45. There's a number of patients that have other risk factors which makes them more prone to develop polyps and cancer. And their screening recommendations are actually even lower.
So if you have a history of colon cancer, you should be screened earlier then. And earlier, you were talking about the 3 different types of tests, but the gold standard by far is the colonoscopy. Can you tell us what is involved in a colonoscopy?
It is the gold standard, Bill, and the reason for that is because colonoscopy is actually a dual type screening tool. Not only will diagnose the disease like cancer, for example, but will also treat it. And we'll treat it by removing those lesions, not just, finding them. And that's the only tool we have that can do both those things. Now, during a colonoscopy, there's a lot of myths out there as far as what a colonoscopy is like, and, people don't want to get it done because of what they hear. But basically what it involves is an initial stage of cleansing the colon from the solid debris or stool that's in there, so that usually the next day, the physician is able to place a flexible camera, basically, through a tube to visualize the inner lining of the colon and the rectum. And just to give you an idea, the colon is approximately 5 feet long, so it's a bit of a long ways to go all the way out to the other end. But colonoscopy is able to do that very, very quickly and very easily. The actual procedure itself is not very long as far as time is concerned. And patients will usually receive medications to relax them basically during this procedure. And a lot of patients don't really remember the actual procedure itself. Some do, but the majority don't. The most difficult part that, people have most issues with is usually the day before, which is the cleansing, as I mentioned earlier. And even on that front, we actually made some improvements with the type of cleansing agents that we have to make it a little bit more comfortable for patients.
And you mentioned lesions. Are those the same things as polyps?
That's correct. Polyps or lesions basically just means something, an abnormal tissue, something that's not supposed to be there.
And if you find a polyp, do you generally remove it right then and there? Is that what you were saying?
That's correct. That's the treatment portion of the colonoscopy. That when you see a polyp during colonoscopy, we have tools to remove it right then and there. That polyp is retrieved, or that tissue is retrieved, and sent off to the pathologist for evaluation. And the pathologist will confirm whether the polyp has any tumor in it or not.
Okay, really good to know. So if there is a tumor in it, is that one you say come back for screening, not in 10 years, but 5 years or 3 years? Is that what happens next?
That's correct. So depending on what that pathology will show on the polyp, then the recommendation for the next colonoscopy is made. If that polyp is benign, meaning that it doesn't have any tumor cells in it, and it doesn't show signs of converting into cancer, then the usual recommendations are between repeat colonoscopy in 3 to 5 years. If the polyp shows tumor cells, then sometimes there's further treatments needed, including surgery, and the repeat colonoscopies are done more frequently, even up to 6 months to a year afterwards.
Okay, gotcha. And last question, Dr. Malalari, and thank you for your time today.
Yeah.
When it comes to treatment of colon cancer, can you talk about minimally invasive surgery and the benefits of that?
Yeah, so we've made quite a few strides in the surgical treatment of colorectal cancers, and one of them has been improvement in our technology and our technique, and that involves minimally invasive options. And this includes laparoscopic surgery, which most people have heard of, but also robotic surgery, which is the newest minimally invasive surgery available for colorectal cancers. What this involves is removing a portion of the intestine or the colon where the cancer is located through small incisions in the abdomen, rather than those big, open incisions that we used to do a while back. The benefits to that are several. The benefits to the patient, obviously, when you have smaller incisions in your abdomen, the pain is going to be significantly less. And when your pain is significantly less, you'll be able to get up and move around much sooner. You'll be able to leave the hospital much sooner and get back to your normal life and your family. But we still do the right surgery for the cancer, meaning that there's no drawbacks to minimally invasive surgery. And we have those options available here in Kern County and Bakersfield as well.
Well, that is really good news, and happy to hear about those advancements. Dr. Malalari, thank you so much for your time. And for more information, please visit dignityhealth.org/Bakersfield. That's dignityhealth.org/Bakersfield. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.